Hello everybody and welcome to lecture number 6. So, today we're looking at chapter 6, Travelling Many Paths, Practice Fields and Methods. So the aims for this lecture is to outline the policy, service and practice context of the field in human services. So to look at the range, the scope, the size, the breadth of practice that we have in human services. To consider the relevant issues for people using services across all those different fields of practice, to look at some major practice methods, aims, knowledge base, skills, applications and effectiveness, and to look to see how these are integrated in generalist practice. So, as you've probably gathered by now, diversity is a feature of social work and human services, and we work in a diverse range of settings with a diverse range of people and in a diverse number and range of situations. So that means, as social workers, we need to be competent in adapting interventions and methods across numerous fields of practice, awareness of the issues in a number of fields of practice, and a target population of different problems and issues. And we need knowledge of policy and service contexts, the different intervention and approaches that we might use, different methods of practice, a range of knowledge and a range of skills. So, historically social welfare workers provided services to the sick, poor or destitute. But as we saw historically, as professional social work emerged, problems expanded and services became more specialised. And today services develop to respond to new and existing human and social problems. For example, HIV and AIDS, the refugee crisis. I remember, this is possibly showing my age, a time before the knowledge about HIV and AIDS, and then when that first emerged, and how shocking that was, that could happen in this day and age. And yet there's still, look at the refugee crisis, there are still things that are shocking that are still happening that services need to address. So these are I just stress, these are some examples of primary fields of practice. So aged care, child protection, disability, health, that can be mental health, physical health, chronic disease, income support, sexual violence, domestic violence, youth, multicultural services, the list goes on and on. And some practice approaches might be advocacy, group work, management, research, policy development, to name a very few. The list can be quite huge. So examples of description of practice. So we've got management, we could have case management, needs assessment, risk assessment, networking, collaborating, policy analysis, psychotherapy, counselling, therapeutic interventions, suicide prevention, supervision, mentoring, youth work, working with children. As you can see, the list is endless. Can you think of any more yourselves, just while we're having a look at that slide? If you can think of any, just make a note of them, because again that will come up in some of the activities we do later, and also in the discussion board. It's also quite interesting just to think of what immediately springs to mind when you think of description of practice, because that sometimes gives you a clue as to where you might be heading, or where you think you might be heading. Just wait till you have placement. You might change your mind. So fields of practice. Factors and services and their delivery. So problems are interrelated. That can be challenging, because where is the delineation of services? If somebody comes with an issue and yet there are other issues, which service serves the need and which need is that? It can be quite complex. It can be difficult for resource allocation when there's multiple layers and multiple complexities. Where do you allocate your resources to? Who allocates the resources? What's the funding? How do you prioritise? Services are place-based. Usually we do have some mobile services, but in general services are place-based. But people aren't necessarily place-based, so that can cause issues as well. particularly if you think of cross-border issues where we've got state funding versus federal funding. And then there's a very clear delineation that services can only work with the community in that geographical area. We've got high incidences of particular human experiences encountered in all settings. So looking at things like peer mentoring and peer support in mental health. Looking at that lived experience. Do we need a lived experience to work in a particular field? Is it helpful? Is it unhelpful? Then we've got funding through competitive tendering for specific programs. So that means that the funding is allocated towards specific outcomes, which means that that is a very narrow funnel through which you're trying to push people, and their needs might not be met by that program. Work can be specialised, like mental health, or done across many areas. Do you want to become a generalist or a specialist? So this degree qualifies you as a generalist social worker, but there are many options to focus in your areas of interest through assignments, through readings, and through your electives. So if you do have a particular interest, have a look at the different electives you can choose, have a look at how you might frame some of your assignments, because some of your assignments ask you to pick, for example, an area of practice that you're interested in. So it's quite good just to have a think, and if you want to explore different areas, great. If you've got an area you want to really get to grips with, that's good as well. We only ask that you're open-minded, because as you will see as we go through the rest of this course, skills and knowledge are transferable. And sometimes you can pick up a surprising array of skills and knowledge in an area which applies somewhere else, and it might not immediately be apparent. So we have different fields of practice, and we're going to look at a number of different fields of practice over the next few slides. So the health sector, what does that look like? So the practice context, it tends to be large budget, it tends to be universal human need, in hospitals, community health centres, government health departments, as well as the private sector. You might be working with all illnesses, conditions and ages. And usually crisis work dominates, as illness is often traumatic and unanticipated. And often the hospital visit itself is unanticipated, although the illness might be long term. I think palliative care, that's a little bit different, but across the rest of the health sector, it tends to be crisis work. Intervention and skills. So how do we intervene, and what skills do we need? Well, evidence-based practice is very important in this field. Usually crisis and short-term interventions, working with grief and loss, working in multidisciplinary teams, finding suitable placements for patients about to be discharged, case management and advocacy. I think some of the students who have been in placement would say that they find that the health sector is quite medicalised, because you are working within predominantly other health professions, and although social work has that social aspect, when you're working in a hospital it does tend to lean towards the medical model. So it's just thinking about what that might look like for you. Okay, so working in mental health. So the practice context, it can be acute and long stay hospitals, or community mental health and non-government agencies. Again, multidisciplinary teams, quite often uses biopsychosocial interventions, often long-term and episodic. And as we mentioned previously, there can be some tensions between the medical and social model. What would some of the skills and intervention methods be here? So case management, as previously, family education and support, particularly in working in community and non-government agencies, advocacy, counselling, group work, community development to address social exclusion, and mental health policy work. So you can see here that this is more long-term compared to the hospital social work, where it was more short-term. But then, having said that, if you are working with people experiencing mental health issues, that usually is across all fields of practice and all sectors. So consider domestic violence, homelessness, child protection, substance misuse. Consider all of those. The field of disability. Mental health can be a common thread across all areas of practice. So you may or may not want to work in mental health, but if you have a placement there, those skills and intervention methods that you learn about will be applicable across most of the jobs that you'll come across. Okay, what's next? Child protection and juvenile justice. So again, this is statutory social work. I shouldn't say again, I was thinking government, but work is conducted by statutory authorities. Investigate allegations, risk assessments, removal of children, support and supervision, partnerships with other professionals. The children in this process are relatively powerless, and the work does tend to be very bureaucratic. It's very much following legislation, policy and procedures, so there can be limited autonomy and client confidentiality and high caseloads. So interventions and skills here, taking referrals and investigating claims, undertaking risk assessments to determine whether a child should be removed from their family. You might be the key worker coordinating activities of care and legal processes. You will likely have to act as a witness in court and write reports for the court, and have a look for alternative care through foster placements or residential care, and then coordinating family support and mediation. Okay, so the disability field. So here, what's a practice context? So we've got definitions of disability, and that influences services, because quite often disabilities, particularly I guess in the government sector, has been very deficit focused, because to access fewer and fewer resources, you need to become more and more disabled, as it were. So you really need to accentuate deficits. So that this is one area which we very much promote a strength-based, person-centred way of working, but the actual reality is it's very deficit-focused. So there's some tensions there all the way through. You could be employed in health services, employment services, rehabilitation, respite, in-home care, family support, early intervention and residential services. Some of the issues are social exclusion, isolation, both for the client and their family. You may be involved with guardianship and family support. And this is an area that does have an increased experience of abuse. So then if we think back to child protection and you think disability, so if you have a child with a disability, they are well known in the child protection system. So here, I think particularly with the disability field, we've got a change coming with regards to the NDIS, but the disability field has traditionally been very sort of underqualified in terms that the entry qualifications for working in the field have been quite low. So there's a whole range of philosophies of people working in the field, and sometimes that might not be beneficial for the person with a disability. So this is a field I think that could really do with a bit of a radical shake-up. And the NDIS is definitely a vehicle for exploring that. So what might we need here? Advocacy skills, case management skills, strengths perspective, as we mentioned, family-centred practice, sometimes alternative communication. So I learnt a language called Makaton, which was based, British Sign Language, and then Makaton was a sort of, I guess, a dialect of British Sign Language, and I still have some, but I used to be fairly fluent in Makaton. Social and political action to change behaviours, and to change attitudes. I'm thinking of bad behaviours of politicians, but I'll stop there. This is obviously one of my areas that I'm very passionate about, so I'll zip it and we'll move on.